first, I want to welcome everyone to our first Industry Insider of the spring semester. We have a great group of panelists with us, TCNJ nursing alum, and they're going to be discussing today resilience in healthcare, disparities, and coping with stress. So this topic was brought to the Alumni Engagement Office, which is where I work out of, and where this webinar series is hosted out of. And I think it really just came out of importance to have this conversation, especially right now. So Yolanda and Charlena, who are both on camera right now, brought this to us. And I just want to thank you guys both for bringing the topic up and kind of helping organize this as it's continued to evolve. And I think it is an important discussion with a really diverse group of panelists that we're going to hear from today. So thank you all for being with us as well. And typically I will do short introductions, but because we have kind of a larger panel today, I'm going to kick it right over to our moderator, Yolanda Nelson, who is a graduate of 2002 and also on staff in the nursing program at TCNJ. Before doing that, I do want to touch on what you just said, Yolanda, about having a question and answer session at the conclusion. So we are in webinar format due to the larger audience. I wanted to make it a little bit easier to follow our panelists and see who's speaking. So that does, I don't want to deter anyone from asking questions. So please feel free to throw them in the Q&A or the chat as we go through the discussion. We'll try to address them throughout, and if not, certainly at the end. And also feel free to use the hand raise feature if you'd like to ask your question live. I'm sure our panelists would love the live engagement. So with that, yes, Yolanda, I will turn it over to you to kind of do a quick introduction of yourself and the rest of the panel. And thank you all.
Thank you. Thank you, Pam. And first, I want to say thank you to the Alumni Association for hosting this awesome webinar we're excited about today. My name again is Dr. Yolanda Nelson. I am TCNJ alumni, TCNJ all the way. That's what we say every day, including the weekend, Saturday and Sunday. But I'm faculty here at TCNJ, been here since 2016. And yes, class of 2002. So I wanted to formally introduce and ask our panelists to introduce themselves. We're going to start with Tanisha Brown, class of 2017. Tell us a little bit about yourself, where you work at, and how long you've been there.
Sure. Good morning, everyone. My name is Tanisha Brown. I am a family nurse practitioner. I've been a nurse for about 22 years in total. I had my undergraduate degree from Seton Hall University, and 10 years after that, got a master's degree. So as Dr. Nelson mentioned, my postmaster's family nurse practitioner is from TCNJ in 2017. Most of my nursing background is mostly emergency room and urgent care, some nursing education and nursing supervision. Since 2013, I've been at Princeton University. I am the director of nursing and health services at Princeton University, and I'm also a provider in express care at Penn Medicine.
All right. Thank you. All right. We're going to move on along to another one of our panelists, Donna, class of 1981.
Yes, quite a while ago. So that puts me in the bracket of more than 40 years of experience in the profession. But good morning, everyone. And I have had a variety of roles in my career, but spent the majority of my career as a nurse executive. And after I left TCNJ, I moved to Philadelphia and got my master's at the University of Pennsylvania, and then was the chief nurse at Penn State Hershey, and moved on to Georgetown and was the chief nurse there, and got my PhD at Penn State University, and then finished my nursing administration career as the chief nurse for the Veterans Health Administration out of Washington, D.C., so for the entire country. And now I've transitioned to be a mediator and a consultant, working with healthcare teams and businesses and business owners in their disputes and working with teams to come together. So that's my experience, and as you said, in the profession for a while.
All right, awesome. Thank you, Donna. All right, our next panelist, Dr. Monica McLemore, class of 93.
Hi, everyone. Good morning from California. It's so good to see you all. My name is Dr. Monica McLemore. I use she and her pronouns. And I'm a proud Trenton State College graduate of 93, as was my father, class of 72, and my sister, the original Dr. McLemore, class of 84. I am so excited and just grateful and just happy to be able to be here. I am a tenured associate professor at the University of California, San Francisco. I am a clinician scientist at Advancing New Standards in Reproductive Health, which is a program of the Bixby Center for Global Reproductive Health. And I'm currently really grateful to be working with the Alameda County Public Health Department and the Umoja Project doing COVID-19 vaccinations for the citizens of Oakland, California. And it's just a real honor to be here with the other panelists. So thank you.
All right, thank you. All right, next panelist is Melissa Owen, class of 2004.
Good morning. I'm Dr. Melissa Owen. I had my BSN as in the class of 2004 from TCNJ. I'm currently at Emory University in Atlanta. I'm the assistant dean for pre-licensure programs and an associate clinical professor there. I've been at Emory for about 10 years as faculty. I actually did my MSN as an acute critical care clinical nurse specialist. I went there directly from TCNJ to finish there in 2005. And I did my PhD at Rush University in Chicago and finished that in 2016. My clinical background is in heart failure and heart transplant. I worked at Emory University Hospital in cardiovascular surgery step down as a heart transplant coordinator. I still have a PRN position over there and do mostly data entry and quality management, in addition to my academic responsibilities. And I kind of have two focuses for my areas of research. And one is palliative care and heart failure and awaiting heart transplant. And then the second focus is building resiliency in our nursing students. So I'm very excited to be on this panel today because it fits with some of the work that I'm doing with our students too.
Awesome, thank you. All right, our final panelist is Peter Rico, class of 2018.
Hey, good morning, everyone. My name is Peter Rico. I go by Pete. I'm sure Yolanda would say that she probably doesn't recognize me because during my time at TCNJ, I didn't have glasses or a beard. That kind of came on with COVID. Mike mentioned I'm only a few years out of TCNJ. I've been working at Duke University Hospital since then. I started in August of 2019. First started off in their cardiothoracic surgery ICU. Did that for a little over a year. And then transitioned to their cardiothoracic surgery operating room. So I've been doing that now for almost 2 years. That's been a great experience. While I was at TCNJ, I took part in the SNAC research grant with Dr. Perrin. So it's something I was really proud to be a part of and contribute to that research. And then in terms of my schooling now, I'm a graduate student at Duke University, where I'm pursuing a master's in clinical informatics.
All right, thank you, Peter. And I would be remiss if I did not introduce to you our president of our alumni chapter, Charlena Barnes. So if you can just give a brief introduction, Charlena. She didn't know I was going to call on her.
No, I didn't. Hello, everyone. Thank you for coming out. My name is Charlena Barnes. I am a class of 2002 from TCNJ. Currently, I am the wound care specialist at Jefferson Health Hospital in New Jersey. So happy that you guys are here and so happy to have you guys participate in this great webinar. Thank you.
All right, thank you. So we're just going to get started in this conversation. As you all are aware, you know, nursing has been at a pressure, at increased demand already, but with the pandemic, it has even become even more huge, right? So that healthcare has felt a huge demand and the increased pressure. Why? With the pandemic, there's been shortage in staff. You know, nurses are leaving because they're burnt out. Nurses are retiring. They're leaving the bedside, right? There's been a problem with lack of resources. So lack of resources and lack of support. So I'm going to pose this question to our panelists. How do you cope with the level of stress in your career or increase in resilience in the workplace? So how do you cope with that when you think about the stress and when you think about resiliency?
Yolanda, I can go first if you'd like. So what is very helpful to me is really beginning by taking care of myself and my definition of self-care. And that is, if I'm going to give so much of myself to others, I need to make sure that I am in the best place that I can be. And so it is really helpful for me to focus on my nutrition, sometimes planning my meals, my lunch, bringing it with me, also getting enough rest and sleep, although that is a challenge sometimes, but making sure that I have a routine to wind down in the evening or in the morning to be able to get restful sleep. And in addition, doing whatever activity is helpful, whether that be working out, doing yoga, or meditation. Those things are very helpful because then I can feel as though I'm centered and be mindful and remind myself and give the best and all that I have to the patients.
All right, thank you.
Let me
Self-care.
piggyback on to Donna, because I think that individual and self-care for us and the people we serve is super important, right? But let's also talk about community care, right? First of all, I just want to thank everyone for the incredible work that we've been doing, right? Nursing has been asked to do so much above and beyond in a impossible situation, in a public health crisis. And so first of all, thank you. I mean, it's such a gift to be able to serve the public, right? And so I don't want us as a profession or a discipline to lose sight of that. And I also want us to think about self-care is important, but what's collective and community nursing care? And part of that, for me really also is it's events like this, being able to engage with our learners and our future colleagues to be able to talk about strategies that we all use to be able both individually and collectively to care for ourselves, each other, and the public. So, I also think that, having buddies in nursing, my best friend, who also is a TCNJ alum, who's here in California with me, she came to help me pack the other day. I still see her, right? The friendships that we create, the connections, the bonds, these will be with you throughout your life. Right. And so you really want to cultivate those. You really, really want to be able to maintain the colleagues and the classmates that you have, because they are going to be your greatest support too. And so the Alumni Association is one of the reasons why I would get up on a Wednesday morning to come and support the Alumni Association. Our institutions matter. And so having strong institutions that can support us, I also think is another strategy to think about these inhumane times we are currently trying to navigate.
All right, thank you. Tanisha?
Yeah. So I definitely agree with Donna and both Monica with all of those things. We definitely need to take care of ourselves in whatever form you see that in. But there's a saying that says do more by do less. And I think for all of us who are in healthcare, that should resonate with you. We are constantly saying yes to everyone and agreeing to do all of these things, and our to-do list just gets longer and longer. And sometimes you have to take a step back and say, maybe I can't do that today, or I'm going to have to hold on to that. And so maybe by doing less, you're doing more for yourself in that moment. The other thing is service to others. I find that when I'm providing service to others, it gives me something, and it makes me feel better, and also bringing my children into it. I remember just something small like donating, to a food pantry, and my son had said to me, "Wow, that feels really good." And it does. When you do stuff for other people, it feels really good. And I think that's a way to kind of help deal with all of the stress that you may have, is to provide service to others.
All right, thank you. All right.
I'd like to add on to what Tanisha said, in that some of it is reevaluating your priorities. And when you're asked to do something or you're taking on new projects, really think about does it align with what your goals are? Does it align with your career trajectory? Does it align with your work balance? As you're making some of these decisions, what to take on and what to let go. I think another piece of it, though, is also taking the charge. And is there opportunity to change the work environment that you're in? Is this a temporary situation? Does it seem like it's going to get better, or is this a long-term situation that's not going to improve? But is there ways that you can work with your fellow nurses on the unit, your nurse manager, whatever the case may be, to talk about what's going on, what's happening with staff morale or patient ratios? And is there any type of change that you can help bring to a unit to maybe improve the working conditions or the environment or the camaraderie among the staff, just to help your own resilience and build each other up at work? Because when you're there, you're spending 8, 10, 12 hours a day, and that's a significant portion of your life. And so I feel like you can do everything outside of work, but we have to also focus on what we can do when we're actually at work.
I love it. Thank you. Okay, Peter has his hand raised.
Yeah, so I think, it's interesting. When I started working as a nurse, I came in at a very peculiar time because any nurse's first year of practice is just generally stressful. And I think that's that's something that every nurse goes through. I don't think anyone starts off as a new nurse and has, like all their skills mastered. It's just not feasible. So I kind of had these initial stressors at first, which is being a new grad nurse and taking care of, really sick patients in an ICU. And then to then throw in COVID into the mix at like the 6-month mark, that was really hard to deal with. And I think, at least the way that I looked at it was I really tried to use COVID to kind of understand just more about like myself and what really matters to me as a person. And I think a lot of people went through COVID and kind of had that similar experience where they realized, maybe I do want to spend more time with my family and, pick up less overtime at work, or, maybe I want to start a new hobby. So that's really sort of what helped me kind of get through the pandemic. I think it put a lot of different things into perspective for me. I grew up in a very urban area of New Jersey, and I'm now an avid fisher and camper. So, those are two things that are definitely nothing I would have started, if COVID hadn't happened. And I live in North Carolina now too, so it's a little more accessible. But, and I really started to realize, that like for me, like what's most important really is seeing my family and friends and spending time with them. And that's something that was totally put into perspective during COVID, and just working as a nurse and seeing people pass away from, COVID or not COVID. But, that would be my recommendation, is really kind of use this time to figure out, what's important to you as a person.
I love it. I was jotting down notes. So our panelists said self-care, community care, collective care, self-reflection, the value of spending time with family and friends. And then Dr. Owens even said our evidence, because they took an evidence-based practice research class, right? Remember that, Peter? So now some of our students and nurses can do projects on resiliency, evidence-based practice projects on resiliency in nurses, right? So great conversation. So as we transition and think about inequities, when considering healthcare disparities, how can we leverage the power of nursing to help and protect all people so that we do not widen the gap when you consider inequities in healthcare?
Well, I'll start this one. I mean, at the height of the pandemic, when we first recognized the SARS-CoV-2, virus was a novel one of the things that I warned people about was that we really needed to think about essential public health measures and make sure that our messaging was very, very clear, right? Wash your hands, social distance, physically distance, and wear your mask, right? Mm-hmm. And at this point in the pandemic, I really think that there's some very simple principles that come out of public health. Nursing is like social determinants of health and resolution of those. That's our lane. Right. I mean, that was a whole fundamental tenet that nursing was based on, especially public health nurses like me. And so when you think about the basic skills, the basic foundation of nursing, if we really wanted to be able to resolve, the disparities, nurses would be leading, right? First of all, we would redistribute, resources based on need, right? Not on proximity or accessibility. We would make sure that the mutual aid that was set up at the height of the pandemic, that we would have just continued all of that, whether it was get me PPE or really working on, folks taking care of their neighbors, meal distribution, all of that, paying people to stay home. That's our lane. But unfortunately, we operate in a system where we have not, we've been barred from allowing our full leadership to come forward. And we've seen this several times in our Future of Nursing reports, wanting people to practice to the fullest extent of their licensure, right? I mean, we could turn all of this around if nursing had the capacity and ability to be able to lead. So that's piece one. Piece two, if we also want to reduce, disparities, particularly for Black, Indigenous, people of color, Latinx folks, queer folks, the people who were already most burdened by disease states prior to the pandemic, then we will prioritize them in the same way that we've prioritized the elderly for vaccines. Now I'm glad that we're seeing, vaccines being rolled out for children and people under the age of 5, but we want our policies to actually match the evidence that we know will be effective for reducing, health-related disparities. That said, we have to use our nurse spidey senses to curate different conversations, right? Everybody just fully accepts that we're a dichotomized and polarized society, and I reject that. We can curate conversation. We do this all the time in acute care settings, translating information for the people we serve from the clinical care team back to the family, back. We know how to do this. We just have to do that in a more public way.
Right. Okay, Dr. Owen. Thank you.
Thank you. So I have two thoughts on it, and Dr. McLemore mentioned social determinants of health, and that is such a huge focus now. It's been built into the AACN Essentials for nursing education. And so our nurses that are coming out of school today will have a very different lens on social determinants of health, what leads to good outcomes or poor outcomes, what puts patients at risk. And so I would challenge our newer nurses to take the lead and educate those that have been out in public or out in nursing for a longer period of time and may not have the same frame of mind or lens to look at patients, and to lead the way in this. The second one is thinking about policy, and nurses are not always as involved in policy. And by policy, I don't mean politics, but looking at when there are bills or proposals in your state, what does it mean in terms of healthcare? Does it increase access to care? Does it restrict access to care? Does it disproportionately affect a marginalized group? And what does that mean? And then how can you as a nurse use your voice to impact that potential policy or legislation? Let your legislators know the potential impacts on health, lobby for the bill if you support it, and really start getting involved, understand the positions of the candidates that you vote for. What do they know about health? What do they think about issues that are important to health? And be an advocate, and then talk to other people about it. Talk to your family, talk to your friends to help educate them as well, because that's another piece that we see that impacts our health outcomes.
Awesome. Advocate. Donna, she has her hand raised. Thank you.
Yes, and perfect alignment with Dr. Owens and Dr. McLemore, that along with the policies, it's really understanding systems, because we all work within systems, whether they be at the local level, in your institution, hospital, the community setting, and then there's the state and the federal. And so understanding how those systems work, what policies, as Dr. Owens mentioned, are being put forth, and then coordinating, communicating, supporting one another to become active and involved, become knowledgeable. Look out for perhaps a more experienced nurse that can help guide you through some of the challenges in how to understand the system. But you can have a great effect by understanding the system and working through that to really make significant changes.
All right, thank you. Anyone? Oh, Peter.
So I would say the first thing that I really want to say is like, it's so important to never forget that nurses are like, we're truly the backbone of healthcare. And I don't know if that's something that I truly realized until I started working as a nurse. Because when you're in nursing school, your only experience to truly working as a nurse is, in your clinical rotations. And they're obviously not as frequent as working as a full-time nurse. So I think, until I started really practicing, I didn't realize just how impactful our work is, and just like really realizing that we are the backbone of the hospitals. Like, these hospitals could not function without the nurses, even super small community centers. It wouldn't be feasible. So, if anyone has the power to change something in healthcare, I truly think that it's at the level of the nurses, just because of how powerful we really are. And the second thing that I wanted to mention is, so I'm currently working on a project at Duke, and I think it's kind of interesting. So it pertains to health equity. We were tasked with essentially implementing a new project at the hospital within teams. And so what my group decided to do is we're taking a health equity index that was developed at a healthcare institution out in California called Sutter Health. And they had designed this metric to essentially highlight health disparities within a particular healthcare system. So then it would alert the healthcare system and say, hey, out of like all the patients that you're seeing, like for instance, Hispanic males have a very high rate of hypertension within the community that your hospital serves. And then it would trigger the administration to start saying like, okay, well, these are the actual like things that we can do to help this particular issue, and then reevaluate the metrics like once the ball's actually rolling. So what's kind of cool for me is an informatics guy is that there's definitely a data aspect behind how we can solve these problems. And for me, I think it's really powerful because when people within the hospital actually look at these numbers, because we can go and talk to people in administration and say, like, healthcare is not fair, and we need to help other populations. But when they actually see the data and look at the numbers, it becomes much harder for them to say like, oh, let's just put this on the back burner, or like, oh, maybe these issues aren't as like prevalent as people are saying. But when they can actually look at the data and say like, this is fact, you can't argue it, I think that's what makes it really powerful.
All right, thank you. And Tanisha.
Yeah, so the one commonality that I see, everyone talking about it's education, and whether it's looking at the data, as Peter mentioned, or looking at policy. One thing that I found that to not widen the gap anymore is through education, and that is one of the things that nurses do very well. That's something that we've been taught to teach, right? Taught to teach our patients. Educate yourself, educate your patients, and educate your colleagues and your coworkers, and the person that lives next door to you. One thing that's come out of this pandemic is a lot of misconceptions and gaps in knowledge, and we as nurses can kind of close those gaps by informing others. I took it very personally over these past 2 years to try to fix any misconceptions that I would come across. So if someone's saying something that's not true about the vaccine or about this, I'd say, well, actually, this is how it works. And you teach someone, and then someone teaches someone else. So for me, it's been a lot of education in order to not widen that gap.
I love it. Thank you. All right. So those that are online, your voice matters. Nurses have a seat at the table. We just can't talk about it. We have to be about it. So how do we do that? Just like our panelists stated, get to know your policies, get to know your bills. You can make a visit to Capitol Hill. I go every year and I meet with representatives to discuss bills, right? So get involved, right? So when we think about servant leadership, that was mentioned earlier, and we talked about community and collective care. What can be done within nursing to better the situation when you consider servant leadership? Any of our panelists, what can be done within nursing to better the situation? Oh, yes, I'm sorry. Dr. McLemore, I see your hand.
Well, I mean, first of all, I think we need to cultivate leaders. I
Mhm.
think a lot of time in nursing, and we're starting to come to understand this. I've been very, very lucky that I've had, programming specifically in nursing that has been moved forward to want to develop nursing leaders, right? Whether it's the breakthrough leader in nursing, a program of Robert Wood Johnson, AARP, the big team of the Susans, right? Susan Reinhold, Sue Hassmiller, you know, having formal coaching and leadership programs in nursing is crucial, right? The second thing I would say, media training. And I know that sounds counterintuitive, right? Because a lot of times we don't have nursing pundits. Like, we are the experts in clinical care, in policy, in research, right? In teaching. And you still see physicians on CNN, right? We still have, surgeon generals. I mean, thank goodness for Sylvia Trent Adams, who was, a nurse in the public health corps, who was, the interim surgeon general. But we still have physicians seen as the arbiters of expertise, even when it's our expertise, right? Media training, right? So it's not just leadership training, it's also knowing how to talk to the media, print, internet, social media, video, television, radio, like all of those different, we have to speak, right? And one of the things that I think is so important, that we amplify each other's voices. That's why I put my consent for social media in the chat. Because when we have activities like these, we want to reach our colleagues, reach our collaborators, right? And then the last thing I'll say is servant leadership is about making sure the next generation of individuals feel competent and confident to take the reins of really being able, like, we know who the next leader of, the American Nurses Association is when Ernest decides to step down. We know who the American Academy of Nursing's next leader is, right? We know we are thinking about that. Not in a punitive way, but in a strategic way. So that the earlier career folks can work side by side with us, learn the ropes, know how to, manage the system, so that when it's their turn, they feel supported in being that next generation. So those are the three things I would say about servant leadership: media training, leadership training, and then apprenticeship for our future workforce.
All right, thank you. Donna?
Yes, I think all of those things that Dr. McMillor said are extremely important. And along those same lines, it is having current nurse leaders really be role models and helping them to see that by advocating and being out there speaking about these things and in the forefront is very, very helpful. And that's what we can do. And then transitioning that knowledge. Developing the next generation of nurse leaders and supporting them, giving them opportunities so that they can have the support while they're trying. And one thing that we don't really talk about, but when we support them, we're not going to get it right the first time. And so it's okay to be knocked down, but you have to get back up and keep trying and change your strategy and your focus. And being there to support nurse leaders while they're doing that can be extremely valuable and helpful. And the last point that I would say is listening. Being open to listen to all constituents, all of our team members, so that we can use that information and data to help us be the best servant leader to everyone.
Mm-hmm. Thank you. Dr. Owen?
And I just saw Tanisha's comment in the chat about the mentorship program. So I didn't want to step too much on your toes with that, but I was going to say, helping younger nurses understand what it means to be a mentee and how to identify a mentor and the purpose of mentorship. And I tell my students or my junior faculty, think about somebody that's in the job that you want, and then reach out and ask, how did you get there? Or look at their CV or their resume and see what steps did they take. I've been very fortunate to have a lot of great mentors, and one of them said, every opportunity is not your final job. Sometimes it's the stepping stone, and sometimes there's 3 jobs before you get to the job that you want or the position that you want. And so understanding what does that path look like, and then coming back to the first topic, and we talked about setting priorities and deciding whether to take on something or let it go. Does it meet that career trajectory, and being very focused? So really understanding that mentor relationship. And then how do you then, one day you'll wake up and you'll be like, oh, I'm the mentor now. You know, you still have mentors, but you're going to be the mentor for somebody else. And so how do you impart that wisdom?
I love it. And know that you might have different mentors for different roles, right? Versus professional, personal. So that's important. Thank you. So any other comments? Any other comments? Did I see any Ms. Hands? No. All right. So we would be remiss if we did not take a moment to acknowledge the other issues and crises going on in healthcare besides COVID, which has taken the spotlight. What is top of mind, or what do you see as a future concern in nursing? And what can you do as a nurse to help resolve it? So what do you see as a future concern in nursing? Oops. Dr. McLemore?
Well, I think there's several, but I'm gonna point out two. And the first is, I mean, we have a national conversation that has been initiated around racism in healthcare, racism in our society, you know, just racism in general. And if we really want to be able to dismantle it, you know, I've been very clear that if nursing really wanted to, we could take care of that too. But it requires a translation of our skill set. And it requires our capacity, our deep capacity to know how to connect with others and to really be able to, again, curate some really difficult conversations. So dealing with sort of the racism in our society, the racism in healthcare, and even in our own profession. So that's the first R. And then the second issue is you know, top of mind for me, because it's the heart and soul of what I do. We need to really have some difficult conversations about reproductive health rights and justice in this country, and how we think about people who have the capacity for pregnancy and how we want to be able to treat them. I'm pretty stunned in 2022 that we are still having conversations about whether or not we should have, you know, paid family leave or extensions of child tax credits. Like to me, this is like one of the penultimate discussions that we need to have, that if we really, really want to be able to center a family, chosen, biological, it doesn't really matter, then we need to have a robust social safety net that is grounded in nursing. I mean, we have developed so many innovative programs that we know that work. When I think about Sharon Rising and centering pregnancy, or when I think about, you know, the OMS's work and everybody who's done nurse family partnership, or when we think about the transition of care models that have come out of the edge runners at the academy, we know how to resolve social determinants of health. We have to stop describing it, and we have to start investing in it to make it happen. So for me, it's dealing with the racism in our country, in our world, in our field, in our discipline, in healthcare. And it's really having an honest conversation about reproductive health rights and justice.
All right, thank you. All right, Dr. Owen.
So I have two thoughts, and they're interrelated in a way. The first is, we talk about the nursing shortage, and it's also important to acknowledge that in addition to staff nursing shortage, there's a nursing faculty shortage, and there will be, if you look at the average age of nursing faculty, maybe not on this panel, but in general, and who's going to teach our younger generations. And there's going to be a high need as we want to continue to build the workforce. And then another issue is having a diverse nursing workforce that mirrors our population that we're taking care of. And this is a priority issue in how do we engage historically underrepresented groups, retain them in nursing programs, encourage them into leadership positions. And I do believe that starts with diversification of nursing faculty. So those are 2 points that we in the nursing profession, in academia, on the healthcare side really need to look at and talk about. How do we encourage nurses to be able to engage in both practice and teaching? How do we break down some of these barriers that prevent or dissuade nurses from wanting to go into academia or to advance quickly, looking at the typical models of progression? So I think these are issues that we're going to need to tackle sooner rather than later, so that we have faculty to teach our nurses to impact the workforce issues.
Right, thank you. You know what, it made me think about pipeline programs and how we have to get started in middle school and high school And, nurses have to go out there and talk about the profession of nursing so that we can diversify, the workforce, but faculty as well. So thank you. All right, Donna.
Thank you. I was actually going to offer the two that Melissa just said, because when I was a chief nurse, I know that people used to approach me all the time and say, well, what about the recruitment for direct care nurses and in the institutions and the hospitals and things? But I was very much aware of the faculty shortage and the impending faculty shortage. And that to me was even more critical sometimes than the direct care recruitment issues that I had been dealing with at the time. But for the profession, they're both critically important, and you cannot really put one above the other. And it really is important for all of us in all generations to find ways to be able to support and contribute to resolving this issue. And starting early, as you said, Yolanda, as a pipeline is very helpful. But having those mentorship programs or a buddy system, that there's someone there to guide them all the way through, if that's possible, depending upon the friendship and the relationship, or in each segment, because nursing's hard, whether you are a faculty member, the demands that are being placed to continue to produce, it is very, very difficult. And we need to support one another to be able to resolve these issues, not just with policies and programs, but also those interrelationships to help support one another to get through.
All right, thank you, Donna. Right, Peter.
So as a new nurse, I would say the biggest challenge for me, or at least that I've seen, it has really been the staffing. And it's just, I mean, what I've seen has really been just unbelievable. So the ICU that I started off in, before COVID, they were averaging, or it was around 90 to 100 nurses leaving a year. This was an ICU that had, about several hundred nurses on staff. So it's a pretty sizable number. The OR that I'm in now, we're short about 17 nurses that have just left within the last about 3 months. So, the nurses are leaving because they're burnt out, or they're going to travel to make more money, or they're going to another hospital system that's paying more. Then the nurses that are left behind at the original hospital are getting even more burnt out because they're more short-staffed. And it's very frightening to see. And I think that as nurses, we need to get to a point where we don't feel like we have to travel or go to another specialty just to be compensated for the work that we're doing. Like, we should be able to work in the hospital that we want, on the unit that we want, and be appropriately compensated. And I think it's very upsetting to see that nurses feel like, I have to take a 3-month travel contract, or I have to move entirely, or I have to go to another unit that pays more or has a better lifestyle just to feel like they're being, treated fairly for their work. I think it's very frightening to see, and I think it's just going to enhance the staffing problems even more. So like I said, as a new nurse, that's really been the most prevalent issue to see. And I think what's scary for a new clinician is, you're very dependent on seasoned nurses around you. Like, those are the people that you go to for support when you have a very difficult patient, or you're struggling just physically or emotionally from work. And when there's no experienced staff left, or when the experienced staff themselves are maybe only 2 or 3 years in, it's pretty frightening to think about, because then those newer nurses, who do they lean on? So that's something that I've really seen over the last 3 years.
Mm-hmm. Thank you, Peter. Tanisha?
Yes, I find it interesting that prior to us planning for this webinar, a lot of us have never met each other, and we're all coming to a lot of the same conclusions. My number one would be diversity in nursing. And when I was in nursing school, I think the number was somewhere between 6 and 8% of nurses were male nurses. And I don't know what the number is right now, but for sure it's not 50-50 still, right? So creating a more diverse nursing population to match, as I think Melissa mentioned, to match the current population seems to make a lot of sense. The second thing I think about is nurses practicing to the highest the scope of their practice, and whether that be registered nurses or advanced practice nurses. There are a lot of things that each group can do that they're being limited and not allowed to do. And most people want to be challenged, and we have a lot to give, and not necessarily being allowed to do that. It's interesting how during a pandemic that APNs have been allowed to do things that we hadn't been before, like, oh, for right now, you don't necessarily need a collaborating physician. And New Jersey is one of the last states that wants to hold on to that collaborating physician agreement. But when the pandemic came around, some of these things were okay. And it's okay for you to travel in between states and practice because it's a pandemic. Like, these are things that we should be doing all the time. So limiting the scope is one of the things that I feel is like, that would be number 2 on my list. And somebody put in a chat, is it 10% now? I think 10%. That is still very low. Happy to see Peter here.
Yes.
Thank you.
Thank you. So I know we have a few minutes remaining, and it's nice to know that we are not alone when it comes to difficulties surrounding nursing, but we would like to end this conversation, this discussion, with some positivity. So when you think about tips of encouragement that you would like to share to our audience, what are some tips of encouragement that you would provide? Okay, Tanisha had her.
So, I mean, words of encouragement, recommendations, advice, suggestion, I don't know. But what I would say is kindness is contagious. And kindness and compassion goes a long way. And it's always, compassion is always at the heart of what it is that we do. And so if you think of that first, then I think all other things would follow. When I was teaching, what I would say to my students is, if you do the right thing for the patient, you will always do the right thing. And so that's something that I like to follow in my career. So that would be my thing.
All right, thank you. All right, Dr. McLemore.
Well, I have to say, I have never done, anything for pay as an adult except be a contiguously licensed registered nurse. And I don't anticipate doing anything else in my adult life for pay. And I think, you have chosen to join a profession of people who want to serve the public. And for that, I thank you. I'm very, very grateful for that. And, I think we can actually make this entire world different if we all collectively decided to come together and strategize and hold our professional organizations accountable to be different, to be bold. And I want our educational institutions to continue to thrive, right? We talked about, sponsorship or mentorship and leadership, but we didn't talk about sponsorship. And sponsorship is a different skill, right? Mentors will help you get where you want to go. Sponsors will grease the wheels behind the scenes to make sure it happens. And so I am really hoping that you understand, as learners, as students, as our colleagues, you can do almost whatever you want to be able to do in nursing. I mean, I didn't think I would be on billboards or meet a president. We need nurses in space. We need nurses like doing all sorts of crazy things. And it's possible, because if the last 3 years of 2 years of pandemic hasn't taught you anything, it's that we can change all of this if we really, if we want to, if we know the levers to pull, and if we can collectively work together. But thank you for joining our profession. And I look forward to seeing what some of y'all do across the future, because I am excited and I'm grateful that you've chosen to join us.
All right, thank you. Dr. Owen.
And I would say, when the days get tough, remember why you went into nursing. I think most of us went into nursing to make a difference. And I think we're very privileged that every day that you go to work, you're making a difference, whether it's to an individual patient, to a family, to a unit, to a healthcare system, depending on what your role is, to a student. And just remember that. And sometimes that can help recenter and reground you into your purpose and, why do you keep returning to that unit every day? So just always reflect on why you went into nursing, and that will help you be resilient.
Awesome. Thank you. Donna?
Yes, thank you so much, Yolanda. And along the lines of what Melissa just said, it's that passion. And I tell everyone, and used to tell all of the nurses when I was the chief nurse, that I believe nursing is the most wonderful profession in the world. And I am extremely proud to be a nurse, and always have been, and always wanted to be a nurse. And remembering that and recognizing that we are so privileged to be with people at their most vulnerable time, whether it be a happy time or perhaps a very sad time, we are there and we are helping them. And that influence and help that we provide to our patients may be large or small, but knowing that you've given your all and doing what you love is so important, and it will come back and we'll be able to give back.
Love it. Thank you. Peter?
Yeah, so, very similar to what Donna had mentioned, very few people have a job where day to day they work with people that are, in a very vulnerable position. Most people in the hospital, they're scared, they're very sick, they don't know if they're going to live. And you're working with these people day to day, and that truly is a privilege. And like I said, very, very few people get to do something like that. And I had actually had an experienced nurse tell me when I first started, you'll never remember every patient that you take care of. It's just not possible. But that patient will absolutely remember you and the care that you provided. And that's something that I think is very, very powerful. And it just shows the impact that we have on people's lives. And I think the other thing that I want to mention, to the seniors out there, I remember when I was a senior, I felt like the entire class, we all just had two concerns. And the two concerns were, I want to pass the NCLEX and I want to get a job and start, get paid. So I think those are everyone's kind of two concerns. And I think, you've made it this far in the nursing program, and TCNJ has a great NCLEX pass rate. So 1 out of the 2, you're already doing great on. And the second one is, I think right now, a positive spin on everything that's going on with COVID is in terms of the job market for nurses, you're very much in demand, and you can get a job anywhere in the country you want. So I think, you're coming out at least at the right time in terms of getting your first job and starting to work as a clinician and getting licensed. So, I would say just don't put too much stress on yourself. I think you're doing this at the right time. So that would be my advice.
All right. Well, thank you. And basically that concludes our webinar for today. I just wanted to speak on behalf of everyone, the panelists. We just want to say thank you to all that have joined us. Whether you take some time to self-reflect on our conversation and know that, you're not alone, right? So you're not alone, and we have some changes to make, some improvements to make, but we got to all hang in there and remember your why you chose nursing, right? And now it's just not your why, but just like our panelists said, you have to get involved with mentorship, get involved with policy. If you see something going on, say, what can I do to make it better? So that might be getting involved in evidence-based practice, getting involved in mentorship programs, going to Capitol Hill, getting to know the bills and the policies, and having a seat at the table, right? And that important note that Dr. McLemore mentioned about sponsorship, take advantage of that. Look into it, whether at your institution, at your hospitals. And important thing is get involved, and that's self-care, whether that means servant leadership, that means taking care of yourself and being an advocate for others. So we just wanted to say thank you again on behalf of the Alumni Association for your time and taking this hour to be with us. So we appreciate all of you.
I do want to just encourage, we have a couple minutes. I know some of the panelists have to jump off. They have prior engagements that are backing right into this. But if anyone has a couple of questions they want to throw in the chat, I think a few of us can hang on to the students in the group, take advantage of it. As everyone just said, you know, you have this wonderful panel in front of you right now. So if you have questions, please throw them in the chat and we'll try to get through a couple of them at least quickly. And if that's not the case right now, I know several of the panelists have offered their information, an email, a LinkedIn. So I'll send a follow-up with how you can contact them in the future with questions. And again, taking advantage of the alumni that have come before you that you can tap into. We have a lot of nice sentiments in the chat that are thanking you all for doing such a great job, and I will echo those.
I'm happy to stay on for a few minutes for questions.
Thanks, Tanisha.
I can stay on as well.
Not sure what our students' schedule may be.
Okay, Dr. Nelson, I see instead of the chat, people are putting in the Q&A section.
Yeah, we have a question from Christina. How can community support nurse and healthcare professionals? Oh, I'm not sure.
How can community support nurses?
Not sure if that was a full full thought, Christina, or if you were just thanking the panel, which is also appreciated. Oh, thank you guys for putting your emails in there. That's great. I'll take them too from the chat. And like I said, I'll be able to do an email blast to those who registered and kind of do a brief follow-up, kind of a recap, and include any of the contact information here. Someone wanted to know, what is Laura Smith's background?
Wants to know that. Because I didn't introduce myself, who's ever left. I work closely with the School of Nursing, Health, and Exercise Science out of the Development and Alumni Engagement Office. And thank you to all the panelists, and especially Yolanda and Charlena for helping put this together.
Yeah, Laura was a huge help in coordinating with our office who to reach out to and who might be great for these panelists. Like she said, she works close with the nursing department, so she really had a pulse on who to reach out to that may be interested. And here we are today. So thank you.
We do have one question.
We do.
Yep. What do you think future nurses need to focus on in terms of collaborating and unifying the workforce to bring change in healthcare?
Yeah, I think this is a lot about what we already mentioned thus far. Like Melissa had said, getting into policy, and if you see something that you don't particularly like or agree with, and then do something about it, right? A lot of people can complain about how their work environment is, but not everyone will try to figure out a way to fix it, collaborate with others in order to change these things. And so I think that's key. And we've spoken a lot about policy and mentorship and education. So I think those are key.
And I don't think we've touched on interprofessional initiatives much. We focus really on the nursing side, but if you're doing evidence-based projects or looking to impact change or impact policy, looking for other healthcare team members. So beyond nursing, so physician, PA, respiratory, anyone else that might be a stakeholder, social work, pharmacy. And as you're having these meetings, bringing those team members to the table to represent their opinion and their profession to really strengthen some of these initiatives and ideas that we have.
Yeah, I think that's great. And along those lines, it's also getting involved in the different committees or programs at whatever level you are in your institution where you work, or at your community level, the state level, even the federal level. And the interdisciplinary practice is so helpful. But my experience has been a lot of newer nurses don't really understand the system as a whole. And so they see something and they want to just change it immediately, and then they get frustrated. So just, sometimes you want to go slow to be able to go faster. And so taking the time to really understand the system and how it works, and meeting new people to be able to collaborate in larger teams can be very beneficial.
I'm glad you touched on that, because as I'm listening, and I'm clearly not in the nursing or healthcare profession, but a lot of you touched on policy and systems. But as someone who may be new, or in my case, brand new, because I'm not in it at all, how to actually do that, where to actually go, is it an online source that I can reach out to? So say I am motivated to get involved in the policy side, where do I even start? So you're kind of touching on that now. Thank you.
Yes, and I can share a personal story that when I was in graduate school, I was taking classes that had medical students and other disciplines, and learning, meeting them, and then having to do school projects at that level, which was a personal goal of mine, but at that level was so helpful that when I was the chief nurse, I had all of those relationships with those individuals from all the different disciplines that just really blossomed and opened up so many doors to bring everyone together to be able to work together on different issues or things that needed to be fixed in the hospital, and have people be able to listen to one another because they knew them on a personal level.
I see there is a question that says, which areas of nursing do you see growing and developing the most in the upcoming years? And are there any new interesting domains? For me, I think everyone wants to say, like, this pandemic is so bad and everything is bad about it, but there are some good things that have come out of it. And my first thought, the thought that comes to mind is telemedicine and kind of virtual medicine. Is something that we didn't so much practice before, and out of necessity, we've had to learn to reach patients different ways. And so telemedicine and virtual visits have now become, a forefront, and it's not something that we need to do just because we can't see our patients in the office, or we can't. But I found that it has come a little bit of more of a convenience for patients also. And so I think that that's one thing that we're going to see a lot more is telemedicine showing up in different ways.
Mhm.
And I would say community care access, we'd already seen that before the pandemic, shorter hospital stays, sicker patients going home, and that sort of access. And then geriatrics with aging population. If you look at the demographics and you compare the birth rate to the aging population, there's gonna be high need in geriatrics and accessibility.
And the other thing I just thought of is, transgender and gender affirming care is one of the newer, and it's something that I am seeing expanding quite a bit. And maybe I see it more so than others because of the population that I work with the college health population. But I think that is an area that is rapidly expanding as well.
Yeah, so very similar to the last two comments. I mean, I think telehealth is just going to continue to boom and community health for sure. For one of the classes I had taken for grad school, we actually did a whole essentially analysis of the University of North Carolina is trying to implement a hospital at home system is essentially what it's being referred to as, where it's going to be for low acuity patients who traditionally would have spent time in the hospital. They're going to be treated at home. And, it seems to be something that's very interesting, and there's definitely some promising research behind it. So I think, this is definitely the direction that medicine is going, to more of a remote world. And, telehealth existed way before COVID. It's just that no one was really utilizing teledoc and stuff like that. And the pandemic really just brought it to light. So I think now it's just propelling this non-traditional area of medicine really into the future, because it takes the burden off of, I don't want to say burden, but, it stops a massive influx of patients coming into the office, and, the clinicians seeing an insane amount of patients on a day-to-day basis. So I think that's where the future of medicine is really headed.
I see a couple more questions that came through. Do you have any suggestions for what you can do as a nurse to help or advocate for yourself when coming into a short staffed shift where you feel your assignment may be unsafe?
So I think, patient safety is the utmost importance. And that's something that I've said since day one of even being in clinical and nursing school, because the focus is on the patient at the end of the day. It's not the clinician. It's truly the patient. That's we're there for them. And I think, when you're a nurse and you recognize that you're in a situation that's not safe, you should not be afraid to speak up. Because I think if you do speak up and it's not the issue is not being addressed and it's not being recognized, that's a huge issue. And that shows you that the work environment that you're in, something needs to seriously change. Because if nurses are coming forward to a charge nurse or a nurse manager and saying this is not an appropriate assignment, this is not a safe intervention for this patient, and it's not being addressed, that's a very difficult situation. You have your license on the line that you have to protect. You worked very hard for it. And I would say don't forget that. You need to speak up when there's a patient safety issue for sure.
Yeah, I think this is a tough one, because I can look at it for me from both standpoints. As I could look at from the perspective of the nurse, and then also as a perspective from a manager, and I've been on both sides of those, and I definitely think that there's a certain way of going about things. A lot of time I've had people say things are unsafe, and I think that different people have different definitions of that. But there's also ways of going things. I think I mentioned one time, during this talk about complaints and complaining, and there's a difference between complaining and also bringing forth, things that may not be right, and collaboratively as a group try to figure out what the issue is. And how it can be managed or navigated, because I think that nurses themselves, what I've found, nurses who work on floors are really good at process managing and figuring out ways to do things that maybe supervisors and other leaders may not be able to. And so suggestions are always very helpful. If you think that a way that a situation can be remedied, I think it's good to just, not to just say this is terrible and I don't want to do it, but also, what about this? What if we did it this way? Or what do you think about that? I know a lot of things have been changed in my unit. I try to do things very democratically, and things have been changed in my unit by nurses saying, we do this process this way, but I think we may have a better outcome if we do it this way. And, you know, from a managerial standpoint, and like Peter said, it's all for the patient. So everybody's always, you know, our goal is the best patient care. So if it's something that's going to work for the patients, then I'm all for piloting something to see if this works instead. And you sometimes, especially with staffing, you have to be very creative across the board. So yeah, I don't think that there's anyone out there that wants to short staff a unit, but I think it takes everyone involved to kind of create suggestions to see how the situation can be remedied.
All right, well, good timing, Yolanda. I was going to say, I think we've kind of wrapped on our Q&A portion. So thank you for those that stayed on and took advantage. I hope that you found it beneficial. This whole panel discussion, I think, was super beneficial. So thank you all for being a part of it. Yolanda, thank you for moderating it. Just goes to show what a wonderful community of alumni TCNJ and Trenton State produces. So thank you once again. And thank you to our audience. Thanks for sticking around, and hopefully you'll join us for another Industry Insider that we have planned in March. So everyone take care, stay safe. Thank you.
Thank you.
Yeah.